Welcome back to Aging with Power. I'm Myles McNamara on your hometown station, AM 1220 KHTS. And today we are talking with Dr. Anil Sharma and Pam Geyer regarding pain management, the addiction of pain management, and the fact that it's not just a physical issue, but also an emotional issue. And before the break, Dr. Sharma, you were talking about not only, I think you mentioned your holistic approach, but the widely ignored aspect of the mental and the emotional part of being addicted or on opioids.
Yes. So in the past, we were treating mind differently than body, but there's a connection between mind and body. You know, in order to have a healthy mind, you have to have a healthy body, and vice versa. So people who are addicted on these prescription medications need to be addressed. You know, it needs to be addressed both ways, physiological as well as psychological.
And we know what happens as far as physicality when we start going through withdrawals and those flu-like symptoms and stuff. What are you just seeing an emotional dependency? Are you seeing some kind of psychotic behavior? I mean, what are you guys seeing when you're trying to put the two together?
So not psychotic behavior, but psychological dependence, increased anxiety, depression, hopelessness, feeling that they cannot ever kick this habit. So that needs to be addressed. Having said that, there are some patients, you know, who go to the other extreme. They experience euphoria, mood swings, or even psychosis in some cases. But that's not the usual case, though.
Well, and that's a big part of it, because I mean, as I shared with Pam and you before the show, I mean, I'm in the process of weaning myself off of these pain medications after my accident, and there is that euphoric kind of glow that you get very happy to have, you know. I mean, even though you have the pain,
not pain management,
right? But you have the physical pain, and along with subsiding the pain, you get that sort of euphoric glow. I can see, and I think I'm managing it okay. I'm weaning myself off. I'm down, down, but I can really see where that would be like addictive.
That's the tough part of managing that, because you have that propensity, but then there's also, it's kind of scary if you've been really depending on something and managing, and you have a genuine fear of that pain becoming out of control again. That fear plays into that. And so you kind of, that's where managing the anxiety really becomes so important, that we are looking at all of those aspects of that person's treatment and that decision to begin to withdraw from these medications. People can become very skilled and very manipulative as a result of these medications. I want what I want because I want it, and it makes me feel better. Like you said, I kind of feel buzzed, and that feels kind of good. And so how do we work with that? And that's really where the skills of psychiatrists come into play, because they do understand those behavioral things that really aren't always within the skill scope of the treater, you know, at the bedside or you know, in a clinic. But as a psychiatrist, they can make those determinations of what is behavioral, you know, and what is, you know, anxiety driven and all of that. So.
And does that animal exist? I mean, so you have someone who has been through a traumatic injury, and now it's time to start weaning them off, so to speak. I mean, is there a process, or is it just sort of left to chance? Is there a program for that?
It's very tough. I mean, this is the very, very difficult piece, because as physicians, I mean, I'm sure the doctor would agree, I mean, you want to help people. You want them to feel better. So I don't think all of this prescribing is because I want to harm you. I'm trying to help you, but we need to step back and realize it actually is harming you. So then now when we have to begin that process of withdrawing, or maybe even identifying somebody has an addictive disorder, something that maybe we need to look at other medications, even such as Suboxone or something like that, that we can begin that process, that's a very hard discussion. And you need someone with a skill set particular to that to have that, because nobody wants to be told, you know, that you've now, you know, developed an addictive disorder, you know, because of, say yourself, you had an accident or something happened. I mean, these are the accidental addicts that really didn't go out looking to have this dependency and to have this condition develop. So that's where really I absolutely love your holistic approach, that mind, body, spirit. Does it exist? It absolutely exists. Is it paid for? Most times, no. And that's where that becomes very difficult, that if you have a family with, means that they can afford to get those services, or they just have outstanding health care coverage, they can do it. Otherwise, it becomes very, very difficult. And I don't think there is a free resource to be able to incorporate that.
Well, so how does one self-evaluate? I mean, if someone is, how can you look into yourself and say, okay, physiologically or emotionally, how do you rate where you are on that scale? I mean, if the pain's subsiding and, or is it more emotional than physical? Is it still more physical than emotional? What kind of withdrawals physically? What kind of withdrawals emotionally? How does one even self-evaluate if there's no official program to see where you are with that?
Well, if your pain management controls your day, I mean, if you wake up, okay, I take this pain medicine at this time, I take this one at this time, and everything you do is geared around that pain, then that's consumed your entire life. That's when you need to see the doctor, and you need to sit down with him and have that discussion as to, okay, this has taken over all of my life. That's not good. That really is a big flag to say, I have an issue here. I need to look at this differently. People withdraw from their families, probably part of that whole depressive component, but then the family gets very judgmental. They're judging them taking the medication, and we don't want to do that.
Right.
We want to always come from a position of compassion and love, and how do we work together on that. But we need the psychiatrist to be a part of that team, 100%.
Well, we're going to run away for our next break. When we come back, we will continue exactly that conversation. And your suggestions, Dr. Sharma, when someone needs to step into that arena with you from the emotional standpoint, because we sort of have touched on the physical standpoint, but it's the emotional standpoint that I think is almost more prevalent than the physical.
It is absolutely an equal partner.
All right, we'll be right back, folks. You're listening to Aging with Power on your hometown station, AM 1220 KHTS. Welcome back to Aging with Power. I'm still Myles McNamara on your hometown station, AM 1220 KHTS. And in studio today, we have Pam Geyer of the pain management nurse specialist variety from Henry Mayo Hospital, and Dr. Anil Sharma, board-certified psychiatrist and clinical pharmacologist. And we're talking today about opioids and the addiction and how to wean both from a physical and an emotional, psychological standpoint. And Pam brought up a very valid point in that a lot of times insurance will pay for the physical aspect of it, but not so much the emotional and psychiatric aspect of it. So, and then as we venture on into the show more, we're also going to segue into some dementia and Alzheimer's talk that Dr. Sharma's specialty also is, and we'll be talking about the family caregiver and the different solutions and medications and such in that arena as well. But to tie a bow on what we're talking about, Dr. Sharma, as far as the opioids and the physical and the emotional and psychiatric approach to kicking this habit, I guess. Go ahead and elaborate on that if you would.
So I would add more to what Pam just said. I completely agree what you said. There's also a major emotional component, and it needs to be addressed right from the diagnosis. So diagnosis, treatment, prognosis. What happens most of the time, if people are addicted to prescription medications, they don't even realize that they are addicted to those meds. It's their family members, it's their coworkers or friends who realize that person is taking more medications than they need to. They are more sedated, isolative, irritable, not going to work sometimes, and it gets to that point. So addressing that is very important, making a diagnosis. Most of the time, patients do not come forward and say, hey, I have prescription medication dependence. It's basically people around them. So we have to not only treat people in person, also we need to train people around them so that they can effectively manage a person with prescription abuse or dependence. Emotional aspect is also very important in treatment. As you know, prescription medications like opioid causes euphoria. And now you are trying to wean them off of those medications, and they fear that they will not have the same well-being feeling anymore. Irritability is very common, depression, anxiety is very common. So as a psychiatrist, when I'm treating prescription drug dependence, I focus on both a physical aspect as well as treating their emotional problems, as well as training their family members. I usually have a family meeting, tell people what to expect and how, and to empower them to help the person.
And how does one, I mean, it sounds like with your program, Pam, we were pointed that direction with insurance and physicians. With your program, not so much. They almost have to independently reach out to you. And Pam alluded to the fact that a lot of times insurance won't even pay for it.
That's true. It's becoming more and more difficult to work with insurance companies in terms of treatment of dependence as well as other psychiatric illnesses as well. So it's a constant struggle with insurance companies.
That's so sad.
Did they discuss that at the pain management conference as far as bringing the two together and having it included in coverage and such?
Well, I think this has been an ongoing battle for many, many years for the psychiatric community, is trying to restore that mind-body together. And as it currently sits, it's not. But it's really not in the interest of the third-party payer to, work with us, because right now they're not paying for it. So financially, there's no incentive. They, in essence, have to do it because it's the right thing. And we all know it's the right thing. They have to be given pressure from, organizations such as the AMA, the ANA, all of these professional organizations that are looking at these individuals can put pressure on our legislature. That's really where the change has to come. And we need that focus in there because, you cannot just treat the physical component. And I absolutely love what you said about the family, because we really try to get that family involvement. Now, unfortunately, I'm sure you see this sometimes. What happens is you end up with that codependency that goes on in the family, where the family member that's taking care of the person that is in the situation, that's kind of become their life too. So their life is about caring for this person that's become dependent. And so you have to fix, you're 1,000% correct. You can't just fix that person. You have to fix that family unit.
Right. Wow. And revisit the statistics for me, because you'd mentioned in a prior show that the statistics are staggering. That
44 people a day die from a drug overdose. Of those, over 50% are due to prescription opioids.
Wow.
That's staggering. In 2013, over 46,000 people died. And if you put that in perspective and you say, 9/11, almost 3,000 people died. I think 2907 or something like that. And we all were in shock. We need to be in shock about this, Myles. This is critical state right now, that people are losing their lives. And we have to make the hard decisions. We have to learn to say, no, here's what we're going to do. And that's very hard for a physician, because they're really trained to help. And I want to do something to be able to relieve this. Maybe we can't. And that's where the treatment of the mind component needs to come in, that if I have to live with this, I need to learn how to live with this and still be able to have quality and function in my life.
Wow. Well, there you have it, folks. We're going to run away for another break. When we come back, we're going to shift gears a little bit. We're going to come back and kind of shift into the dementia Alzheimer's world, another specialty of Dr. Sharma, and have him share some of his not only his research, but his workings on a day-to-day basis with not only, again, the patients, but the families that are struggling with dementia and Alzheimer's, and the family caregiver and such. So don't go away. We'll be right back. You're listening to Aging with Power on your hometown station, AM 1220, KHTS.